there's so much opportunity. I don't want to say there's so much wrong because I mean that's negative. There's so much opportunity in the healthcare system that trying new approaches carries very little risk. Almost anything that we try to do is going to be better than the status quo, in my opinion.
Welcome to Broken Benefits. I'm your host, Lee Lewis, and this is a podcast where we learn from top employer experts on how to fix our broken benefits to save lives, save dollars, and save your talent. So excited to introduce today's guest, Milt Ezzard. For many of you, he needs no introduction. Milt has been an institution within employer benefits for decades and has most famously been the leader previously over at Activision Blizzard, where he became known as both a thought leader and also someone who is always willing to test and help develop exciting new concepts, new point solutions, new technologies, administrators. He's been one of the early adopters in almost every major technology that's come through the industry. And during that time, he managed a medical cost trend without cost shifting below 2% for over a decade. He's one of the best benefits executives in the country. So excited to have him today. Thanks so much, Milt Ezzard, for joining us today on Broken Benefits.
Appreciate it. Glad to be here.
I am interested first in starting with that theme of new. Why should employers more enthusiastically adopt new strategies, especially understanding that many of them are hesitant because a lot of them don't work out?
Well, I mean, as I think is commonly known, employers shoulder about 2/3 of the cost of healthcare in the U.S. I think it's also commonly known that the current structure for delivering healthcare is much less than perfect, probably stuck in old habits of employees and their families using the healthcare system the way they've always used it. Uh, Physicians driving the decision for people that often isn't optimum, and obviously the cost of healthcare continues to escalate at a really fast clip now. I think we're looking at a 6 to 8% trend in the coming year. Um, all that said, there's so much opportunity. I don't want to say there's so much wrong because I mean that's negative. There's so much opportunity in the healthcare system that trying new approaches carries very little risk. Almost anything that we try to do is going to be better than the status quo, in my opinion. It may still not be perfect, but it requires us, I think as employers, the duty is on us to do these, if you want to call them early adoption experiments, in order to prove a concept that hopefully we can share with the rest of the country and the rest of the world and make it become something that will eventually begin to move the needle in the healthcare industry in the U.S.
How would you describe the difference between your approach and that of many of your peers, especially as it relates to new technologies? What is it that makes these especially attractive to you?
Well, I came from a tech industry background, right? There's a couple things that are attractive about technology. Given that it was a tech industry background, the employee base was very open to cool and exciting new approaches. Um, it's no secret that technology brings with it a whole boatload of efficiency over kind of conventional means of accessing care, of being able to track data, being able to secure data in a way that maintains privacy and responsibility, and hopefully provides ways that we can integrate things in an interesting way. That is all leveraged by technology. The other principle about technology that was very attractive to me is to be able to provide an equitable benefit landscape for a population that may be decentralized, right? You have a fair amount of people that are hybrid, people working remote, a lot of people outside of the country, perhaps. And technology gives us the ability to level the playing field with regard to access to the same experience, and people feel more fairly treated and supported when you use technology.
Now, you're going to be beginning a brand new role at a new employer. It's not necessarily the same type of employees as you're used to. And you've been at your old role for so many years that a lot of the innovations you've implemented have compounded on each other. I think that's probably fair to say that the difference between a typical employer might be pretty significantly different than where you're coming from. And what I'd love to do is walk through your approach. You're now observing a brand new health plan, and what are the different categories you're going to evaluate? Maybe we could start with that, or what are the major categories of opportunity you're going to be evaluating, and then we could go into each of those separately.
Yeah, it's a pretty complex question, because it's not a linear sort of evaluation, if you will. I think there's a lot of things
Okay.
that happen at different points in time that are running in parallel. So um, when I joined this organization, the first thing, and it's a very large global organization. The first thing that I would hone in on are the low hanging fruit, obvious, coming in the door and quick look at the horizon of what's there. um, there are certain obvious cues to what might lie beneath with regard to opportunities, right? So quickly understanding the vendor set that supports the plans, um, having a sense of whether some are best in class, some are maybe what I would consider convenient turnkey solutions that employers might turn on that are maybe clustered all in one solutions, which may not reflect necessarily best in class in all categories. Um, Obviously, the spend PEPM is something that is an easy one to quickly evaluate. Benchmarking of plan efficiency. So there is the ability to benchmark against our peers using a third party, which equalizes the health risk. It normalizes for geography. It normalizes for all these different factors, plan design, to slot rank a certain company's healthcare delivery to the rest of the benchmark ecosystem, if you will. Um, so those are where I start, and then finally the presence or absence of available data, right? I learned pretty quickly that even though it's a large global company, we had very, very little data in which to sink our teeth into to find out what's driving costs, what are our opportunities. um, and then finally, plus is reviewing the obvious cost drivers. High cost claimants in a self-insured world are what are driving the cost. you know, End of story. 80% of costs is driven by 1% of the population. And that's a great benchmark to look at and see what opportunities might be to impact that cost.
What are some of the solutions that you've found to be really effective that, if you were running consumer reports, what would be kind of best buy practices, sort of the handful that you found to be very reliable that many people might miss?
Well, I think best buy practices, reliability comes with good virtual care resources, right? That once you get a population, a membership to adopt, proves the quality, proves the efficiency, and proves the long-term value that they bring. A good, one
Mhm.
doctor on demand or teledoc or whatever virtual primary care is one that easily surpasses the one-to-one ROI, right? It's easy to discern that it's a good
Okay.
investment. So that's one. Um, More recently, I think we've had a lot of pressure with GLP-1s, right? The
Hmm.
adoption of a GLP-1 solution that, number one, provides people access to metabolic care that they may be getting through having their doctors write, off-label prescriptions, doing all kinds of shenanigans in order to get access to these drugs. Having a solution that manages, gatekeeps the appropriateness of a GLP-1 prescription and then helps people ramp down their use of GLP-1s as appropriate is one that I think is a bit still controversial to be able to say, hey, population, we're going to support GLP-1s and metabolic syndromes beyond, diabetes and prediabetes. However, in my short couple of years of having the experience of adopting a solution like that, it tells a really good story. Employees are really thrilled that we're supporting them in that way. And it also cuts off the inappropriate use of those GLP-1s, if you will. So if somebody's got a BMI of 28, I don't necessarily need them to be on a GLP-1 in order to shed their 5 pounds. We need them to try other methods of getting that goal met. So that's proven quite effective. Um, I think the other thing that's really important is the TPA that you choose. Um, Insurance company, whoever's processing those claims and having that member face to face or phone to phone is critical in order to get the membership in your plans to either be on board with the solutions that are being offered to them or to be suspect and reject those. So, getting those members in a place where they're having high satisfaction with the TPA leads to all sorts of other benefits we can leverage from that, right? They're feeling like we're on their side,
Yeah.
we're supporting them, and if I'm suggesting a proposed solution for them, they're more than likely to not treat it with suspect.
Everyone, now just a quick word from today's sponsor.
Lemonade for 50 cents. It's for a good cause.
This situation seems terrible, right? Well, what if I told you it actually happened in the United States in 2021? These are the families of people who work for companies just like yours. Give your employees 100% medical coverage with Catalyze Health.
I want to zoom a little closer on the TPA topic for a minute. Many employers don't even know the difference between sort of a carrier ASO and having a separate TPA. Maybe you could highlight a little bit of what that difference is and maybe some of the pros and cons of having that independent TPA, independent administrator.
Yeah, so a lot of us use carrier ASO models where we're contracting with Aetna or Cigna or United Healthcare, and we're using their ecosystem of networks. We're using their ecosystems of claims processing and portals and so forth and so on, which I will give credit has evolved quite a bit, in the last few years to be respectable. However, they're still built on an old architecture, and they're still sort of limited with what they're able to do with regard to early intervention or engagement with populations, I believe. An independent TPA is obviously you're paying a third party to adjudicate claims, to interact with members, to send out EOBs that can be much more highly, I think, customized and high touch. And it also provides us the ability to pull levers on engagement that may not be available with traditional carriers with ASO agreements. Now, the trick is the TPA has to rep, provider networks of one form or another. The cost isn't always as efficient, if you will, as using an
Yeah.
all-in-one solution ASO kind of carrier model.
If you were to split kind of the attractiveness that, adds up to 100% between having more control over claims payment and financial matters versus having more control over experience, telephonic, member interaction, and delivery, how would you calibrate the appeal that you have? This is really interesting because many people with whom I speak comment a lot on, oh, I want that independent TPA because I want to be able to have control over the dollars and the money. And they may never even bring up the experience, but you strike me as someone who's pretty deeply focused on the other side. And I'm curious about how you would balance where you see
I mean, that's
opportunity.
evolved a bit, Lee. Several years ago, I would have said, "Oh, I'm all about member experience and engagement with the TPA," and the other stuff I presumed was to be taken for granted. Um,
Okay.
what I've learned sort of painfully is that not all tech companies who become healthcare solutions do a very good job at it, and not all healthcare
Hmm.
solutions are very good tech companies, right? So that is a balancing act that has to be considered whenever we're moving into some of these new relationships with innovative partners that are often run by Silicon Valley, sort of startup mentalities that um, the blocking and tackling, if you will, of the basics of healthcare management, of reporting, of accuracy also has to be thoroughly locked down, because if that breaks down, it ruins the rest of the model. So I'm very balanced, I think, now with regard to the value of each in my mind. You have to be really good at both, and that's the hardest thing to find. And it has to be something that has to be tolerated on either side and massaged a bit to get where it needs to be.
I want to back into something you said a moment ago. I have never heard this before, even working a million hours in this industry and only staying out front. You just mentioned that when you have a TPA, you can get some control or customization or massaging around the delivery and design of EOBs. Would you mind teaching me about that?
So it's a matter of the example that I have is working with a TPA, where we were trying to get higher engagement with a second opinion service, right? Or we're trying to get higher engagement with a shopping service like a healthcare blue book, if you will, where people can
Sure.
buy an MRI. And we worked with the TPA in order to customize their EOV to say, let's say a member went and they had an MRI from a conventional hospital and it was expensive and all that, and the EOB comes through. We were able to work with the TPA to say, hey, um, did you know you could have saved blah 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 dollars had you used this product that's available to you? So in the future, hopefully the member is taking a look at that EOB, and it's bringing home to them the fact that the opportunity is there for them to have more control over what ends up being on that EOB, right? So it's a matter of queuing them in on um, other resources available, connecting dots of a claim that came in that was a high claim, if you will, for what could have been a much lower claim, and triggering a message to the member that says, in the future, it's all about conditioning and education.
That's amazing. And so almost dynamic EOB creation based on different health use
Yeah,
cases.
exactly. Yeah. So that's the potential there to do.
And that's that's remarkable. Did you have the chance to test that and
Yeah,
what
we
kind of
of
results did you?
course we put it in place, tested it to be able to know the impact of it. I wasn't able to measure, given the size of the population and the numbers of MRIs that we were having, to be able to tell, if it had a big impact. A lot of times people they'll have an MRI on their knee and they won't need another one for a decade, right? So in order to have
Oh, that's
that
right.
work, um, I was not able to prove a case, but it certainly made sense to do, right?
Oh, totally. One of my favorite use cases in all of behavioral economics is the water bills in California. You, as a proud California Santa Monican, uh, have you seen these on the water
I
bills?
haven't lived there in 5 years, but um,
Oh, I didn't know. In your past, this is an old use case. This is an old use case.
yes, water is a very sensitive topic in California.
Right, but the use case was they wanted people to use less water, and so on the water bill they put in a paragraph that said, "This is how much water all your neighbors used," and they had sort of a line on the. It was like a whisker bar, and this is how much water you used, and you were either above or below the line. And they found that something as simple as saved like a quarter billion gallons a month or something, putting that onto just that one little paragraph onto the water bills. And that has stuck with me ever since I first learned that, I don't know, 20 years ago. as a use case in human psychology, right? And I've thought a lot about, oh man, how could we sort of put that in on healthcare, right? Whether communicating to people to consume more carefully. And lately, my opinion has been changing on, hey, how can we communicate to doctors to maybe prescribe more carefully or refer more carefully or things like that. Like, hey, you're referring every patient to 4 specialists, like cut it out, right? You're way above benchmark, something like that. Anyway, you're the first person I've ever heard who's put it into the EOB. This is fascinating. Uh, Tell me a little bit more about risk. So you are many people think, oh, well, I could never be like Milt because Milt's fearless and he's a tech guy and he's able to do really creative, innovative things, and that just comes naturally to him. But I know you well enough. You're not actually taking more risk than anybody else, even though it looks like you are. You're sort of the magician on stage who's sawing the assistant in half. And the wink is that the audience perceives an enormous amount of risk, but there's none at all. Could you maybe walk through how you approach risk and how you de-risk what appears like sawing someone in half?
Yeah, I think it to me it comes from, and this may sound strange, a really close relationship with whoever the CFO finance team is at your organization, to get them to understand what the current state is, um, meaning the current state of the efficiency of healthcare, what we spend, getting them to understand what drives the costs, um, and then, you know, getting them comfortable with the idea. Because I know a lot of my peers are fearful of, they may want to implement something that may seem as innovative and risky and whatever. However, they have to go to their finance team and ask for an incremental X amount of dollars in order to do that. And the finance team sees that as incremental cost, right?
Right.
Getting the finance team's trust that we got a really good understanding of our cost drivers, we got a really good understanding of what potentially might be controllable, and we have a good understanding of things we want to invest in order to manage those costs. Um, and then on a regular basis, providing updates on how things are trending. Data. It's all about, you know, what is our spend this quarter compared to what we projected it to be, what changed from the prior quarter, what inputs and outputs have we gotten. Those are all critical. I had an experience where I was launching a well-being platform, a decade ago, with what used to be called JEP and other Castlight. And the promise we made was we would track the effectiveness of that platform, and try to determine if there was an ROI. Like, it's always, everybody scoffs when you say I've got an ROI for my wellness, because you can never prove it. But we mapped, the participation in the well-being platform to our medical data warehouse. And we were able to, have high adopters, medium adopters, et cetera, based on the incentives they earned. And then we could map that to their annual healthcare spend. And we were able to tell a story that the medium to high adopters spent on average less than $1,200 a year than the rest of the population. You and I both know that the people who adopt the well-being plan are probably, it's a chicken and the egg thing. They're probably healthier. They're probably
Yeah.
smarter about how
There's some sampling
right.
bias there. Sure. Like
But
that's okay.
having simple data to show to the CFO locked that program in to say, yeah, this is a good investment, you know? So
Yeah.
it's about gaining the trust of the CFO, and then then you can have the freedom to experiment with new solutions that may seem risky. You paint a story of how it is, the direction it's going to go without intervention, and then the potential solutions to it that are frankly much less expensive than maybe one or two high cost claimants, right? So I always say, look, we're worried about this 100K here, this 200K here for a solution, but I have a list of 100 people who generated claims of over $200,000 a piece, and we're only benefiting one person, right? We can invest in something that is equivalent to a high cost claimant and benefit the entire population, perhaps, and maybe move a needle. It's all about perspective and context.
I'm hearing that your getting finance team buy-in is critical to to doing something new. That finance often mistakes investment with cost. They don't know the difference. Everything looks the same unless you do some education. Third is that education ought to look like a story, and that story should be data driven. Where if you can tell the cause and effect story of this, yeah, this all looks like cost, but this segment here is investment. And it's because if we do A, it can lead to B, and here's the numbers that we will track in order to confirm that. Am I thinking about that right? I love this model.
You're thinking about it right. And I think about it as elevator pitches, right? If I could, if all my benefits brethren and sisters could be schooled in how to give a good elevator pitch to their leadership about the story that we're trying to tell, I think that would open up a world of opportunities for us. I think we're often very good at administration, at trying to communicate, at making sure we're compliant, all those things. But are we good marketers and advocates for what we want to do through really strong elevator pitches?
Oh my gosh, I love that. How did you learn that? How does anybody in benefits learn that? Because I completely agree. That's an unbelievably powerful skill, is succinctly telling a story to help convey, because everything in healthcare is complicated. And so
Yeah, nobody wants to know
we
it.
can empathize with finance, looking at it all and saying this is all a giant bag of cost. It's an unwritable bull. There's nothing we can do about it. Let's just use it as a plug figure, close our eyes, and hope it's not too big next year. And we can, as complicated as it is, we can have some empathy there. But if you can take pieces of that and demystify it, what I'm hearing is you were able to do that successfully and were able to get a lot done. How does somebody learn that skill?
I think it's just part of, maturing and confidence in your trade and getting enough, becoming hardened to the fact that if we're in this business to improve people's lives and support people better, and also become not just overhead to the business, but value adds to the business. If we get that in our soul as far as what we really want to accomplish, then it comes sort of naturally, right? It becomes, I always think about company money like it's coming out of my own pocket. It seems very strange, but I'm always
Completely.
like if I'm trying to negotiate with a contractor at my house, I'm fighting for the best price I can get and the best quality I can get. And I feel the same way about company money that and I'm responsible for spending. I want to, you know, I want to, like I always say, to my Mercer colleagues, I want to go for the kill and get the best we can for our dollar and really influence the way our vendors, are able to serve us, right? So once you have that sort of fearless attitude about things, and you keep in mind that the only risk is really beating what the status quo is, which is kind of horrible, right? You've
Yeah.
got to find a way to get that message across, and
Mm.
it just comes.
Such an important principle that the most disruptive thing possible
And I
is
think
the status
the
quo.
other thing is being really, really, really comfortable with the data and the way the data is presented. I think if you're really comfortable with understanding what your costs are, and you're really comfortable with understanding what your cost drivers are, and then you become comfortable with the bright and innovative solutions that might impact those cost drivers, then it's a very natural thing. I think a lot of people are afraid of the numbers. I think a lot of people are afraid of the trend. I think a lot of people are afraid that they're not as smart as their Willis Towers Watson or Mercer actuaries that are kind of cramming down their throats the way it should be. um, it's really not rocket science, people. It's simple math. and it's simple human behavior that we're dealing with. And
Mm.
there are better ways.
You've talked to us a little bit about how we can use data and tell stories to finance in order to get internal buy-in to try something new. Now I want to shift to an area where you have dominant expertise, and that is when I am contracting with a shiny new object kind of a vendor with a charismatic CEO with a twinkle in her eye. How do I contract with this vendor so that if they totally face plant, it doesn't wreck my credibility?
Yeah, contracting's obviously how you hold your vendors accountable, right, for what they promise they're going to deliver.
And
And
maybe it's not just contracting, but how do I manage that relationship overall? Certainly contracting is an important part of it, but walk us through how to de-risk that, because a lot of those can go wrong. It's impossible. No RFP is going to predict the future, but you de-risk it in a way that it doesn't hurt your operation, even if the worst case scenario occurs.
yeah, I think a lot of it is it comes through experience of getting a vendor, maybe a new player, to let you see behind the curtain a little bit, let you meet, the individuals that are actually doing the work,
Hmm.
that are actually doing the planning, um, and being willing and actually offering to be a part of their development, if you will. So, um, it's a great opportunity. If it's an early adoption situation, vendors are very hungry for input um, from, employers that they're eventually going to market to, right? So take advantage of that and be certainly willing to dive in and work on them on their marketing, on their messaging, on their branding. I mean, it can go from sky's the limit. I often turn vendors off because I just hate the brand. I hate the name of the company. Um, it doesn't mean anything to an employee whenever they're what was one? And maybe I think there's sort of Ginger IO is used to be the big mental health app. And I used to beat up their founder over the name of their product because if I'm going to message that to my population, say, this is your mental health portal, how is an employee who could care less about benefits going to come across the website and see Ginger and know that's for their mental health, right? And it turned out the founder had used that name because, his mom or his grandmother used to feed him ginger when he didn't feel well. And okay, good for you. I'm glad that's meaningful to you, but it doesn't work for the rest of the population. We never hired them, obviously, because I was annoyed by the branding. So it's getting involved in influencing the product so that when it does launch, you at least know what it is and it's not going to be a big fail. So on the back end, you want exit clauses that allow you out of the arrangement if something goes south. Frankly, I'm not a pilot person. I don't like to pilot products and test them because number one, launching a pilot is much trouble or more trouble than full scale launch. Number two, if you were thinking the pilot was good enough, then it should be good enough for the entire population. And number three, you're taking a year or two of efficacy away from the rest of your population that they could be taking advantage of because you have to run the pilot, then evaluate the pilot, and then make a decision if you want to go full bore. So I don't do pilots typically, but I will make sure the contract protects us in a way that number one, we can exit if we need to. Number two, in some cases, we have the pilot or the vendor financially on the hook to unwind us and move to another solution if needed. And number three, NPS scores number for sure are at risk for their fees. So typically
Mm.
we have a very, very high NPS threshold, 70 and above usually. If they're not meeting that, then we get money back. I mean, there's
Yeah.
a lot of risk for the vendor financially, so they better be good when they dive in.
Everyone, now just a quick word from today's sponsor.
Mom, are you crying?
No, sweetie. Just some allergies. Come here, let's go play. Come on.
1 in 4 Americans had trouble paying a recent medical bill. Many of these people affected work for companies just like yours. Start giving your employees 100% medical coverage with Catalyze Health.
What I'm hearing here is we all get approached by these vendors who have these great stories, looks compelling. A lot of people will look at that and be like, that's interesting. Call me after you've done it 10 times with people just like me. And what I'm hearing is actually, and we do that because there's risk there and we want somebody else to bear that risk. And if you happen to be the first one to try it, then obviously there is risk there, but that the sort of the Jedi mind trick is to turn that around and make the vendor absorb and digest all the risk. So you body shield the vendor with that risk around experience, around delivery, around accuracy, lots of exit clauses, escape hatches, sort of ripcords to pull, and and then don't mess around with the tiny pilot, but create enough risk protection by pushing that onto the vendor that it's okay. You don't have to do a lot of work for just a few people. You can do this for the whole population. Just make sure that you've got good precautionary measures in place and good data, which has been kind of a through line. Am I thinking about the right? Is that
Yeah,
sort of the
you are.
model?
And then the benefit you get out of all this is
Oh,
most favored nation pricing, always, right?
yeah.
The ability to influence the product, look and feel, and user experience, because they're at that point building it for you because you're first and early, right? I don't want to necessarily jump into a product that has been, around for a few years and is already like locked and loaded and may not fit,
Yeah.
our idea of what works for us. So I want to be able to influence that early.
Yeah. I love that. And what now let's maybe pivot a little bit in this vein. What's a risk, like a worst case scenario? Like what's one that you tried that didn't work well? And how did your precautionary measures bear out when it did go sideways so that it didn't, hopefully wreck your year or a couple of years?
I mean, fortunately, we haven't had any career-ending
I
situations.
think by virtue of the fact that you've handled this so well, yeah. So what the worst case scenario probably may not have been that big of a deal because of what you did here, but was curious.
Yeah, I think the worst case scenario probably really wasn't the fault of the vendor. Um, it had to do with a product that we had purchased. There was a big drive for fertility support,
Mm-hmm.
and my employer and people wanting, more and more and more kind of treatment support for fertility. And we offered a product that allowed couples to improve their chances of conceiving naturally, because they're better tracking and better, holistic sort of approaches to conception. Um, and we launched this product, and the product seems fine and it worked as intended. However, there was a huge concern over privacy that was raised by the employees, and this was early stages, early 20 teens, I guess, um, when tech was fairly new in healthcare, when that sort of app-based solutions was prevalent. So there was a huge concern over privacy and the fact that the inference was the employer is tracking your bedroom habits and they're tracking, all that other stuff too, which is absolutely furthest from the truth. So it was sort of a press disaster for us for a minute, that we had to respond to and reinforce the fact of people's privacy being protected and data being aggregated and not visible to the organization. So that sort of, I believe that desensitizing of the population hadn't happened at that point, Whereas I think now probably people are pretty comfortable using tech products if they want to. I mean, they're voluntary
Mm.
after all, right? That's the bottom line is anything that you offer is an offer, not a mandate. Um, and that's what, we had to learn to make sure people understood. Um,
Yeah.
so that was my biggest, sort of headache, if you will, in all of this, using new approaches to delivering healthcare.
I love this as an analog to where we are headed right now with AI. A few new products that are coming out are creepy cool, so to speak, where like AI, I've been absolutely fascinated recently with, for instance, AI therapy. So, AI therapists in every study where they're getting tested, it's like the AI therapist is empathetic, great listener, patient, never loses their temper. You can speak to him at 2 a.m. in Tagalog and speaks it fluently. I mean, it's really compelling, but at the same time, there is a lot of that concern among the population around like using AI. This sounds so similar to what you're describing about kind of newer app-based products that my employer might be sponsoring in the early 20 teens. Just is I couldn't help but see. I'm like, oh my gosh, we're seeing this again. So I love I, looking at it from that perspective. How do you think how do you think we approach some of these new AI products, given that sensitivity? And maybe you already gave it to us right there that hey, everything's an offer, not a mandate. Do it, you do you, right? But
There's that. Yeah. I think obviously yeah, it is cool, creepy. That's all I got to say about it. Um, I will undoubtedly want to offer a lot of this stuff. I think. I think, part of the magic with the opportunity we have as benefit leaders is oftentimes I think we feel like we are always on our back foot with requests and demands for things that employees think we should be giving them, right? And when we provide them, then we remove kind of this dissatisfier, if you will. I think, the magic that we have at our fingertips oftentimes is being able to um, provide a solution that employees didn't realize maybe existed, didn't realize is something they needed or wanted. Yet the employer was thoughtful enough to scout out and smartly select products that they could offer their employee base that actually delight them because they didn't ask for it, but it brought them value. And that's, I think, where we have, that can be leveraged into so much, right? So at one point we offered a new tech baby crib, the SNU, back in 2018. I think we launched that program. We were, I think, the first employer to do it because I was living in Santa Monica there, and the developer was there, and our CEOs got together, and the next thing you know, we were going to offer the SNU. Um, People went crazy when we did that. I mean, they were like shock and awe of excitement that the employer was going to offer them this baby bed that was going to give them 2 more hours of sleep at night, and the baby, it was high tech and all this and that. From that point on, anything that we wanted to roll out was grasped with open arms by the employee population because they knew that kind of we had their backs. We were going to support you in ways that you didn't ask for it. We did it out of the goodness of our relationship with you.
yeah,
Got us an amazing amount of credibility with the employee population. So those are always the opportunities that I'm looking for, right? Those magic things that people didn't ask for, but we know they will get value out of, right? And have a good business case to them on top of it, all wrapped up into one. How perfect, right?
I love this. In during the conversation, there's sort of been a paradox almost where on one side you're saying we need to track the crud out of what people think about our offerings. That's the NPS tracking. So we're constantly looking at that. But then on the other side, you're not asking people if they want a faster horse. You're looking for something totally new, and you're not asking everybody what they want. You're trying to find something they never knew they wanted. I don't know if I'm putting words in your mouth, but I'm hearing
No,
both
you're
sides of
exactly right. I'm so opposed to employee surveys on this stuff. I mean, I'm horrible. I mean, I'm part of a total resort boards operation with lots of committees and lots of people to give input. And frankly, I don't want it. I know that sounds cruel, but just let us do our magic, you know,
Yeah.
and you guys enjoy it.
But you totally are looking for it. You're saying, look, I don't I don't care what input you have on what you think I should do. Just let me do my thing, and then I will absolutely have you sound off on what you think of it, right? Like, because you are absolutely following that. You want to know how right you were, so to speak. But like, let me just trust me. You're gonna love it. And then you can tell me what you think after. I find this delightful. This is Willy Wonka level of sort of keep it walled off, then I give it to the market and you can enjoy. What do you tell me more about how do we know how much we can impact retention and attraction and trust and loyalty through benefits? Many people, this is very hard to do, and many people believe it's impossible, which is absolutely incorrect. It's just so hard. It's sort of like believing in a black swan. It's like, oh no, that doesn't exist. It's like, no, it absolutely exists. You just have, it's so rare that you haven't seen it. But you built benefits that impacted retention, attraction, talent strategy, and that's black swan rare. Would you mind telling us a little bit about how we build benefits that can be that loved and how you prove it out and track it, if, to the extent you're able to?
Right. I think, number one, the what I call them the commodity benefits, the check the box, healthcare, life insurance, 401k, all those things are not differentiators. I don't care how great your plan is. I don't care how good your match is. For the most part, people can leave your employer and go to another employer and get the same experience, or at least they think they can, right? When you offer the magic products, those small, low cost uh, drivers of sentiment of support of the organization that are unique are when you're able to understand how much that means to people. We offered a program called Wealthy, which is simply it's sort of social workers on steroids, which help your family members navigate a situation. And I'm a big believer. I don't necessarily interact with employees very often, but one of the things that I am committed to is every year during open enrollment is actually doing some of those sessions and seeing people and inviting spouses and all this and that to tell them what's new and what's changed maybe, right? During an open enrollment session, typically you go to open enrollment sessions, people are complaining or raising their hands, you bump the contribution, whatever. I hate that, right? I want to go to open enrollment sessions and have people say, and this is true. I mean, they'd raise their hand and they say, if you change anything, at least don't change collective help. Don't ever get rid of them. That's
Oh
one.
yeah.
The other one was we had a gentleman, this is more of a heartbreaking story, but he had a child that was wheelchair, you know, a life in a wheelchair, was on Medicaid.
Mm.
And he used to have, a lot of time spent working with Medicaid to pay for a drug that was covered 1 month, but not covered the next month and everything else. We hired this program called Wealthy, which is very efficient. I mean, it's about $2,000 per employee that uses it in a year, right? And not everybody's going to need it or use it, but he's Wealthy, and they to say, give me all your claims and we're going to work with Medicare and figure out what's what, right? So they took all of that off his plate.
Hmm.
He raised his hand. He goes, I used to think I could leave this place, but I could never leave it because
Hmm.
this is what I'm able to get from you that I can't get from anybody else, right?
Wow.
So it's about the small differentiating factors that make a difference to people. All the where you're spending the hundreds of millions of dollars on healthcare and stuff, actually they think that's an entitlement. They're supposed to have that. They get that anywhere they go. But the really cool things that you do, like a well-being incentive program where they can earn, thousands of dollars by actually engaging and going to the gym and scanning in and getting a reward every time they go to the gym. Things that are unique, um, that, set us apart is what makes a difference. And yeah, you're right. It's hard to measure, and unless you have gobs of time and experience, and you figure out what the turnover was before and the turnover after, and was it regrettable turnover, or was it turnover you wanted? All that stuff was hard. But
Mhm.
Glassdoor is a fun one to look at. When people are coming or going, and they rank benefits as being awesome or not. Right? Those are things that we look at. Yeah, there are unfiltered kind of surveys. If you're lucky enough to get a place on that survey that says, I think the company supports me well or not, those kinds of things make a difference. Um,
Mm.
but I've never been one when, a vendor is trying to sell me on, hey, this is going to bring presenteeism up X% and it's going to boost productivity, X%. I kind of discount all of that. I don't really want to count on that as being the reason, right? To
Right.
offer anything. I need more hard measurable things that are kind of pure to know whether something's working or not.
Oh, I love that. Looking at the separate indicators, I'd never heard about thinking about Glassdoor, but you're right. You can rate benefits on Glassdoor as well. Well, look at that. It's a great idea. Especially, I mean, if you're a tiny employer, it's a little trickier, but at scale, a that's a free survey, and it in many cases it's also an exit interview. I mean, you're getting as unvarnished as you'll ever get, and it can skew negative, right? If you're probably getting 20% of really negative opinions and maybe 5% of people who are super satisfied are on there a lot. Nevertheless, that's great. I mean, if we know that it skews a little bit negative and we can still stick that landing, that's amazing. How should we think about people who are newly coming into benefits? So closing out here, what advice would you give for somebody who's just brand new in this role,
I mean,
but wants to, be part of the solution?
yeah, I think the advice is look at this as an incredible opportunity to make change, right? Like we started, the current situation, the current healthcare system is, so not optimized in the US that this is a point, if you're new to the role, where you have the time and the opportunity to really evolve things, right? And as employers, where we're on the hook for 2/3 of the healthcare spend in the country, it's on us to be able to influence that change. It isn't going to probably happen otherwise. So I think that's what I would say about it. It's just like, have fun with the fact that it is broken and you can go in and really make a difference.
Now, I love that message. This has been wonderful. If somebody wanted to reach out to you, what'd be the best way to do it?
Oh, LinkedIn's always
LinkedIn's great.
a great win. Yeah.
Perfect. Perfect. Well, thank you so much. This has been magnificent. Thank you so much for all of this. And for everybody listening, thank you so much for tuning in. Please share this with a friend or a colleague who could enjoy or be able to use this message. And we'll see you next time. Thanks for joining us on Broken Benefits. If you enjoyed today's episode, please subscribe to our YouTube channel or on your favorite podcasting platform. Also, please share today's show with a friend or colleague. It's free to do, and it helps us spread the message to as many people as possible. Until next time.